Hi, in this video I'd like to talk to you about another common cause of miscarriage, recurrent miscarriage, and also potentially infertility. Today's topic of discussion is adenomyosis, which is getting much more common in today's age, when we see a rise of this number of cases of young women developing adenomyosis. So adenomyosis is also another form of endometriosis. Endometriosis means when the endometrial tissue, which means the tissue that lines the endometrius, this tissue has certain properties such as shedding and also secreting certain hormones and also allowing implantation to allow for pregnancy. Now, this tissue, when it is found to be growing outside where it's supposed to be, which means it's supposed to be growing on the inner lining of the uterus, if it is found to be growing anywhere outside here, other than this area, we call this endometriosis. Endometriosis can be further classified into a few groups. Now, the most common one that we see is chocolate cyst, because this endometrial tissue is now growing in the ovaries. And then there are other forms as well, such as adenomyosis, where the endometrial tissue is found to be growing inside the muscle walls of the uterus, inside the uterine walls. Now, this is much more difficult to observe. And then they can also grow in other places. Common ones also include the pelvis cavity. So anywhere in the pelvic cavities, we will call these as pelvic endometriosis. And they are not limited to where they can grow. They can grow in a lot of places, such as the anal regions, within your stomach regions as well. They are not limited, although they are much more rare. These are the more common ones. So, key difference between the chocolate cyst and the adenomyosis is that one has severe menstrual pains and the other has no menstrual pains at all. So the chocolate cyst, the endometrial tissue that is growing inside the chocolate cyst, the distinct symptom that we will let our patients know is that you will not suffer from any menstrual pains, whereas adenomyosis will cause some of the worst, probably the worst menstrual pains out of all other gynecological conditions. Adenomyosis has a history of causing severe menstrual pains and also affecting your period, your cycle, and also your ability to get pregnant, and also recurrent miscarriage. So upon diagnosis, a lot of hospitals, conventional treatment will be either using electrosurgery, which is using electric current to actually remove these lesions, which means these endometrial tissues inside the uterine wall. But then these are not so effective, and then sometimes they also recommend hysterectomy, which means they need to remove the uterus instead. This is a very damaging procedure, and it causes the patient to lose her ability to get pregnant permanently. Here at Antai Hospital, we have developed a specialized surgery specifically to treat adenomyosis. So what we do differently is that we, instead of using electric surgery and hysterectomy, what we do is that we need to use 3D laparoscopy to go inside the uterine walls and actually physically and accurately remove all these lesions. All of these have to be removed one by one. And then afterwards, we will also give you some form of medication to prevent them to growing back in that area. After these removals, we will need to place a bioadhesion barrier so that it doesn't recur, and also helps with the recovery of the patient. Now, upon receiving full treatment here at Antai Hospital, we can guarantee that you will no longer feel menstrual pains, and you will no longer be experiencing recurrent miscarriage or miscarriage. We can assure you that you can have a healthy pregnancy and also have a healthy baby. So to find out more information about our adenomyosis treatment, diagnosis, what are some of the most uncommon symptoms, please visit our website and also get in touch with us today.